What is the significance for us in myofunctional therapy of seeing a patient with a bifid uvula? What questions should we ask? Should we do referrals?
So usually there are some screening tools, but if it's something, even myself, like I've found a few patients, I should have put the pictures in, not that it pertains to fees, but I have good pictures, especially with the light up the nose where you can see where the bone is missing for a submucosal cleft. It can sometimes indicate that the palate didn't form completely because you ended up with two uvulas. The way the face forms is back to front. So when it forms back to front, if there's any midline deficiency, sometimes you will get a bifid uvula that it wasn't fully closed properly. So the palate should be checked, which is anything any pediatrician, physician, dentist, ENT should also look for. But I did a training with a couple of SLPs. It was about 10 of them, and we found two submucosal clefts. And one of them had been in ortho, I think 3 times.
Wow. So that was going to be my next question. Do you know if these patients can get an expansion?
So everyone I've asked, I haven't gotten a consistent answer. And the one wasn't expanded. She was just given clear aligners, braces when she was younger, but no formal expansion. And I asked, like, does it make the hole bigger? Do you then have to repair it? But no one really that I asked had ever experienced it. And her own orthodontist didn't know that she had it.
Yes, because if you think about it, most orthodontists are taking a panoramic x-ray. The traditional orthodontics, I don't really think you can see it on there. If I'm wrong.
Not if it's small enough, and they do feel that if it's not causing any issue with nasality or there's any deficiency in terms of how the soft palate elevates, that there's really nothing to do. But I was asked, like, in terms of implications for, like, what if she needed to get Markby as an adult? Like, what would happen with her? Is it going to cause an issue with the integrity of this expansion? How many people are they getting that have that? Because to find that many in one training, I was like, I've seen maybe 2 of those in my whole career that I found by accident, And I try to always put a light up the nose of someone where I feel like if they sound like they're not having good resonance, to just see if there is any deviation in terms of the palate.